Section number 2 of our bacteria of Spirochetes family, which are the spiral shaped bacteria. We have already discussed Borrelia burgdorferi, leptospira interorgans. Now we will discuss in this video Treponema pallidum. We will discuss Treponema pallidum. It is a spirochete bacteria which are spiral in shape and thread like shape. So I have break down the words. Trepo means to turn and nema means thread. Treponema pallidum have ability to turn and is a thread-like bacteria. Treponema pallidum can cause the syphilis, which is infection in the humans. The syphilis consists of the three stages we will discuss later in this video: primary syphilis, secondary syphilis, and tertiary syphilis and congenital syphilis, because Treponema pallidum can cross the placenta and infect the fetus. So Treponema pallidum is slow-growing organism. The slow-growing nature have a medical importance that the drugs antibiotics used against the Treponema pallidum can be effective for several weeks. We will discuss at the end of this video in the treatment section which antibiotic is used. Transmission of Treponema pallidum. Only the humans are reservoir for Treponema pallidum. Animals are not reservoir. The transmission can occur through lesions of skin and mucous membrane. For example, it can occur through genitalia, mouth, and anus of the infected person with T. pallidum. Now we will discuss primary syphilis. Primary syphilis, there is one of the most important clinical sign, which is the appearance of the painless ulcerative lesions on the genitalia, such as here in this image we have discussed of penis. There is the appearance of painless ulcerative lesion of penis, which is known as genital chancre. This painless ulcerative lesion starts appearing at the site of contact of the T. pallidum. This painless ulcer heals spontaneously without treatment and leaves the Treponema pallidum in the bloodstream. As you can see in this 2D image, there is a male genitalia and we can see the red spot which is on the glanus penis, the genital chancre, which is the painless ulcerative lesion of penis. And we can zoom in and see the Treponema pallidum. Secondary syphilis. The symptoms of secondary syphilis takes 1 to 3 months for its appearance. Note that the primary lesions we discussed in the primary syphilis, such as the genital chancre, will be resolved and completely disappeared, and it disseminates the Treponema pallidum in the blood. The secondary lesions start appearing due to the dissemination of Treponema pallidum in the blood. The three important clinical secondary lesions of the secondary syphilis includes the maculopapular rash on the palms and soles, which can be also seen bilaterally on the both hands, and Condylomata Lata, which are the moist lesions of the vagina and the penis. And we can also see patchy hair loss, alopecia in the secondary syphilis. We will discuss constitutional symptoms of the secondary syphilis. As we know that the secondary syphilis is a disseminated variant of the syphilis. The Treponema pallidum is disseminated in the blood, so it can go towards the various organs and systems, can cause the generalized symptoms, such as these symptoms may occur or not. The constitutional symptoms includes the patient may face or not are low-grade fever, malaise, generalized lymphadenopathy, weight loss we can see, anorexia, headaches and myalgias can also be the part of the constitutional symptoms of the secondary syphilis, with including Pharyngitis, Meningitis, Nephritis and Hepatitis. So the infectious disease will progress to the latent phase after appearing these symptoms. It takes 1 to 2 years for getting in the latent phase of the syphilis. It is also known as tertiary syphilis. In this phase, we can see granuloma formation of the skin and bones, which is known as gomas, and there is the cardiovascular system and central nervous system involvement in tertiary syphilis. In cardiovascular system, we can see aortitis, inflammation of the aorta, where there is the tree barking appearance of the aorta. In CNS, it can cause neurosyphilis, where there we can see meningitis and tabes dorsalis. Meningitis is the inflammation of meninges, and tabes dorsalis is demyelination of the dorsal column of the spinal cord. Let's discuss the congenital syphilis. The pallidum can also cross the placenta after the 3 months of pregnancy. It can cause the congenital abnormalities in the fetus. If the mother is treated in early pregnancy in the first trimester, so she can cure the fetus from the congenital problems. In congenital syphilis, we can see dental abnormalities such as Hutchinson's teeth, which is the nosed appearance of the teeth, and Mulberry molars, which means the molars are improperly developed. T. pallidum can also damage the eighth nerve, the vestibulocochlear nerve, and can cause the deafness. And it can also cause the deformation of tibia, and it is also known as Sebershins. It can cause saddle nose, which is the indentation of the nose. The nose is indented. And it can also cause the frontal bossing, which means the prominent appearance of the face. In congenital syphilis, we can also see raggeds, which means the wrinkling of the angles of the mouth. Snuffles, which is the nasal discharge of the Treponema pallidum. Hepatosplenomegaly is also seen in congenital syphilis, followed by interstitial keratitis, which is the inflammation of cornea, and congenital syphilis can also result in stillbirth, preterm or the postterm birth. Now we will discuss diagnosis and treatment of the syphilis. In diagnosis, three tests are used. The three different laboratory methods are used. Number one, FDA-ABS test, which is the fluorescent treponemal absorption test, which is the conformity test, and venereal disease research laboratory test and rapid plasma reagent can also be used to diagnose syphilis. And in treatment, penicillin G is the drug of choice for the all three stages of syphilis disease, syphilis infectious disease. Note that the benzathine penicillin releases slowly from this depot form. So as we know that the nature of Treponema pallidum is very slow, it grows slowly. This drug benzathine penicillin releases slowly, so it matches the combination of Treponema pallidum. That's why penicillin G is the drug of choice. The slowly releasing of drug and the slowly growing of organism is a combination and a perfect match for the treatment of syphilis. Allergies, the patients who have allergies for the penicillin G can be treated with tetracycline such as doxycycline. In neurosyphilis, we can treat the patients with ceftriaxone because it can easily cross the blood-brain barrier and can cure the meningitis.